Hello and welcome to my podcast, Your Total Glow, your podcast for your body, mind and soul to support, guide and empower you to uncover your most glowing, healthiest and feel-good version of you. I am super excited that you are here because if you ask me, there's nothing that looks and feels better. In today's episode, I'm speaking with the absolutely wonderful Darlene Greene. Darlene is a stem cell activation technology consultant, and she's on a mission to help you to activate your own stem cells, repair DNA, reverse age, improve the health of your brain and cardiovascular systems, and get out of pain. Darlene is a powerhouse. Darlene is a retired US Navy commander who helped to establish the Returning Warrior Weekend Workshop 17 years ago. Today, she really is focused on helping people to optimize their health and to get to the root cause of issues that are causing illness. She really wants you to get out of pain without drugs or pharmaceuticals. Darlene wants to share and offer affordable solutions with photobiomodulation technology that she wishes she had known about 4 years ago when her husband was diagnosed with Alzheimer's. Because after 4 years of steep decline, he experienced dramatic improvement in his memory, in his energy, in his overall engagement, sleep, and also task capabilities in his first week. So yes, Darlene will talk to you about her own experience with this amazing new technology. And I am a huge fan myself, and I can't wait for you to dive into this amazing interview if you too want to really optimize your health and well-being and live your best life. So please enjoy. Here she is, the amazing Darlene Greene. Hello and welcome, beautiful Darlene. I am so excited to have you here with me today. How are you?
Ruth, I'm honored to be here. I'm super excited to be with you and your audience.
Okay, I want to jump right in because I know that you have so much to enlighten us with, but let's start with a simple introduction. Who are you and what's your passion?
Thank you. Well, I am, I've done a lot of different things in my life. I'm a retired Navy commander from the United States. I had 26 years of experience in executive leadership and senior management across a very diverse set of industries, from being a vice president of strategic technology partners at McAfee to being the dean of Culver Girls Academy, a boarding school. Currently, I'm the director of client services for high-tech networks and security, but my passion is helping people activate their stem cells through elevating their copper peptide to repair their DNA, reverse age, get out of pain through the latest photobiomodulation technology that I discovered in my search for trying to find something that would help my husband who's been diagnosed with early Alzheimer's.
Wow, such an amazing, powerful introduction. And yes, I am really excited to dive more into this topic of stem cell reactivation. And it's really amazing because our paths crossed, and I actually got curious about those patches before I even got to know you, and have had the honor to try them for myself a little bit and absolutely love their effect. But obviously my knowledge and expertise around those patches is nothing compared to yours. So honestly, I'm so excited for you to dive deeper into this topic and help me and my audience to understand better how we truly can empower ourselves with it. However, before we go into the nitty-gritty, maybe explain a little bit about your husband's journey and how you came across those patches and what have they done? How have they helped so far? Because this is exciting stuff.
It is, and I appreciate that. And just kind of to start off, we had tried a lot of things. We had gone to Mexico for IV stem cells. We had done hyperbaric chamber. We had done blood spinning ozone therapy, infrared sauna regularly, definitely the Dr. Bredesen protocol with the keto diet and exercise and training and all of the, organic and non-genetically modified foods, all the things that you could possibly do, and really just did not see any difference. So when a friend of mine who knew that I'd gone to Mexico 4 times in a year and paid $10,000 a pop for an IV and stem cells and had injections that were really painful, knew that, she said, you have to try these stem cell activation patches. They activate your own stem cells. And I said, hey, we will try absolutely anything. I mean, we're desperate. The decline was pretty severe in 2 years. My husband was sleeping 3.5 hours a day. He was then falling asleep at 7 o'clock at night. He was no longer even engaging in conversations. He was detaching. I think conversations were just so hard. He couldn't find the words. He wasn't even making an attempt. And in fact, his personality was always to be very, very funny. It's what I fell in love with, is his sense of humor. He's so funny, but he wasn't even trying to be funny anymore. We had been working on deep sleep for years, including red lights and all sorts of, don't eat 3 hours before bed, get your eyes on the morning sun, take melatonin, all the things you could do for deep sleep. And we were getting a whopping 15 minutes of deep sleep for him. So a lot of things that were very frustrating. So we started patching, and in the very first week, he didn't nap at all. So those 3.5-hour naps he was taking, where I wanted to wake up and just go like, are you alive? No naps. Did not fall asleep at 7 p.m. Was chattier than I've seen him in years. Like just talking and funny and zingers. And with it, we got on a call. We always do a every other week call with his brother on Zoom. And he was just like firing away, just on point, where previously he'd been like 3 conversations behind. So in 1 week, the difference was absolutely mind-blowing. And of course, that was him. I actually experienced a huge difference too. But let me finish with him first. His second week, we recorded the best sleep he's ever had in his life, 1 hour and 25 minutes, which I just almost cried, because that's when the brain flushes and gets rid of those toxins, and it's so important to repair. About 2.5 months in, he regained the ability to whistle and drum to the beat, which he'd lost. And honestly, it wasn't really pretty trying to watch him try. So really happy about that. His blood pressure dropped. It had been way up at like 172/94, and they wanted to put him on meds, or 160/86, and they wanted to put him on meds. And I was like, I really don't want to do that, because part of the problem is if you drop the blood pressure too low, he's not getting enough blood to the brain, and there's some controversy around that. So we didn't do that. But guess what? By the 2.5-month mark, his blood pressure dropped down to 135/87, like between a 25 and 37 point drop. And then at the 4-month mark, there was this very weird, you probably would know about it. It's like a nodule that was underneath his skin, like a big marble. It had been there as long as I had known him, 20 years. And it was kind of weird. You'd poke at it, it'd move around, but it didn't hurt him. It just was this big marble-like lump. It looked really weird. It just disappeared. So 4 months, I was like, where's your little lump? It was just gone. At the 5-month mark, he regained his sense of smell. This was lost 15 years ago. 15 years ago. It's actually an early warning indicator for Alzheimer's. I did not know that. So that was just amazing. And then just kind of for fun, I'll share, he has had a bald spot that's significant in size as long as I've known him. His bald spot has closed in dramatically. It is at least half the size of it was previously. There's hair inside. His hair is darker. It's now like a chestnut brown, not gray. So all of these things have improved. A lot of neuro skills have improved. That's not to say he's cured or fixed. We are really careful at LifeWave to make sure that we use the disclaimer that we are not intended to cure, treat, diagnose, or prevent disease. And even if it does, We're not allowed to make those kinds of claims. So I want to make sure I'm clear on that. But this has been remarkable for him. And as a result, for me, I will just quickly jump, if that's okay, with what it's done for me.
Absolutely, please.
Okay. So I was not as, I was not as dire. I will just tell you though, I had a lot of pain. I had a broken foot, a sprained ankle. I had torn one ligament entirely and another ligament 90%. I have been diagnosed with chronic fatigue syndrome, fibromyalgia, POTS. I had regular headache, had rosacea all over my forehead, and acne and eczema for I don't know, decades. Like I can't even count. I don't even remember not having it actually. I had trouble losing weight no matter what I did. And so I was not doing well. I actually will tell you, I think I was clinically depressed. I think the impact of being laid up and having to ask my husband to get me a glass of ice water, which was hard. Okay, start with a cup. The cups are over here. Now, this was all so hard that every time I asked him, he would say, well, can you write this down? I mean, that's where we were. Mm-hmm. So it really kind of all came to me like, I don't think I'd asked him to do anything for me in a really long time. And here we were, I was really up close and personal with how degraded the situation was. So I was really kind of down in the dumps. I wanted to cry every day. I was in pain. Things were not good. So first week on the patches for me, I'm out of pain. That was the first time in 5 months I'd been out of pain. Our ice wave patches that take people out of pain are just exquisite. They happen immediately. And the first time I put it on, I was just like, that's just not impossible. And then I'd take it off, go to bed, and in 15 minutes it would come back. So that was really astonishing. But more than that, I stopped passing out when I would stand up. So part of POTS, the postural orthostatic tachycardia, is you stand up too quickly and everything goes black and you get faint. And I mean, once it starts, it's really hard to stop, and it kind of happens for the day. And so they actually prescribed a medication for me, fludrocortisol, that I was to take to increase my blood pressure. I'm not taking that. I haven't had to take that. And I've been able to play pickleball in the summers of Arizona here, which was not possible for me before. My regular headaches went away. My rosacea went away. It took 3 months. It did not happen very quickly, but it went away. And where I had, previously couldn't even put lotion on my face, I used the Aloe Vera lotion that is part of Lifeway's product line. It's super clean, and it was just cooling, and it felt fabulous. I lost weight without trying. I wasn't stress eating. That was amazing. I think for the first time in my life, and since at least high school, I had a very normal relationship with food. I am a self-proclaimed sugar addict, like a lot of us are. I'm either bouncing between salt and sugar, and I wasn't interested. I didn't need it. That's when we have a patch that actually conquers sugar and hunger cravings, and I was using that, and man, did that make a difference. So I lost weight easily, and my body aches were reduced. So I guess the best thing though was my depression lifted. I actually started to see somebody before I started the patches, a clinical therapist, like, okay, my husband's got Alzheimer, therapy through this. I'm going to need to navigate this with some grace, because there's no room to take out any level of impatience on this sweet husband of mine. He is a darling. So after like being on the patches for a month, I said, I'm really happy. I don't really feel like I need to see you anymore. And she said, yeah, I don't really think you do either. So that's kind of proven. We actually have studies, and I'll talk about those studies later, but that talk about the brain balancing and the reduction of inflammation and the reduction of anxiety, and the balancing of our hormones, and just all sorts of benefits we can talk about. So that's kind of my story. And I have a million testimonials of friends. My sister with 6 years of microscopic colitis, who it just disappeared in 3 weeks, was no longer she had tried everything from IV stem cells to antibiotics and steroids. Nothing made a difference. And in 3 weeks, they went away. Lots of stories. Agent Orange leukemia friend who was on his deathbed and was told, we're going to give you this drug. It's going to kill you, but it will give you a higher quality of life until you die. And the same person that introduced me to the patches said, cousin, do not do that. Please try these patches. And he did. And in 2 days, he was bouncing out of bed. And in 2 weeks, he's traveling and he's not using his walker and he's not using his wheelchair. And he's not on any pain meds. His white cell count is dropping and he's living a very high quality, normal life right now. Her daughter, by the way, this is new since I last spoke to you. So she has a rare genetic disorder, kind of autistic. And this is how she got into the patches to begin with, is she was looking for something to help her daughter, who is 16 years old, but kindergarten level. And in 5 weeks on the patches, she was a changed child, transformed, calm, no longer needing ADHD medicines, testing instead of kindergarten, upper third grade, lower fourth grade, academically and mature wise. It's now been 9 months for them, and they just tested her, and they tested her executive functioning at a 16-year-old level, which the doctor said he does not understand. That's not supposed to be changeable since birth. Like, that executive functioning is not something that's supposed to change over time. He's just like, I don't understand. So she is celebrating as well. So there are just bazillions of testimonials on these products, which is why I'm talking about it. I will tell you, Ruth, a year ago, I would have never, ever, ever gotten on a podcast. I would not have gone in social media. I posted when my daughter graduated from the Naval Academy. I posted when this daughter graduated from the Air Force Academy, and that was kind of it. But now I can't stop talking, because if I would have known about these 2 years ago, where would my husband be today? And I think about all the people out there who need them right now, and we cannot get the word out fast enough.
I couldn't agree more with you. And thank you so much for sharing all of these stories, your own, your husband's, your friends, your clients, your family. So I feel this is really where we have the same passion. And to me, truly, it's a testimony how amazing our bodies are, and that they truly have the ability to reset, to rejuvenate, and to rebalance, given the right support. And why I am so passionate about these patches is that they are not invasive. I personally think, for what they do, they are very affordable. They are super easy to apply. So there is no real no to it. So why wouldn't we just help our bodies to upglow, to up level for whatever we needed, we wanted? So that was my thinking behind it. But you know so much more about these patches, and you've also been mentioning that there are so many different kinds, and this is where I really want to learn more from you, because I feel what I've been doing is very premature. And tell me more about the different kinds, and how can we really use them to help, to empower ourselves first, but then to empower those around us. This is so amazing.
It really is. So the big patch, you're at least on the number one, the one everyone at least needs to start with. That's called X39. So the reason is X39. First, let's back up a second and make sure everyone in the audience understands. Our stem cells decline as we get older. So by the age of 30, half of our stem cells are dormant. And by the age of 60, only a small number remain active. So I'm 58, and that means that I have hardly any that are still active. That means I'm aging faster and I'm healing more slowly. So stem cells have the ability to become any cell in the body. They're pluripotent. They can become tissue or bone or cartilage, anything they need to be. They reduce inflammation. They trigger the death of old cells that need to get out of our bodies. And so the thing that this X39 patch does that's just so incredible is it elevates a specific copper peptide called GHK-Cu. Now, GHK-Cu is very well studied, very published. For 50 years, they've done a lot of studies, and it is known to do some amazing things, including activate stem cells, but also produce growth factors, protect lung cells, It's an amazing antioxidant and anti-inflammatory. It's superb for the brain and the nerve. It actually alters expression of human genes. So it puts them into a third of your genes get reprogrammed to their younger, healthier state. And which ones are those? I don't know. But when you're talking 4,000 genes getting reset to their healthier natural state, that's amazing. They also, it also improves things like cognitive function. This is GHKCU, cognitive function, memory, clarity, concentration, focus, energy, sleep, and the growth of new blood vessels. And for the heart, it reduces fibrinogen, which is the top predictor of cardiovascular disease. It increases myostatin, which inhibits heart failure. It has this huge anti-cancer effect. So not only does it top 1309 bioactive compounds, but it resets the programmed cell death. We talked about that a little bit ago, of human cancer cells, from neuroblastoma to leukemia to breast cancer. And it doesn't affect the healthy cells. It inhibits NFKBP65, which is believed to promote cancer. It repairs damaged DNA. And it also resets 84 of those 4,000 genes we talked about to basically to inhibit cancer. It does amazing things for skin and hair. In fact, for your audience that can see, I have all of this little broccoli forest of new hair growth that's unruly and it doesn't sit down because it's like popping up like crazy, like my husband's, but I'm fine with that. I'm like, bring it on. I'll take new hair growth any day. But that's because it increases collagen synthesis, which is collagen is the most abundant protein in our body, as you know. So that means we end up looking younger. We have our skin gets tightened. And softer and repairs. It reduces fine lines and smooths out. In fact, I had a brown spot that was fairly significant on my face that just disappeared. So that's really cool. It accelerates wound healing. It increases all kinds of healing from the stomach to the intestine to the bone. I've got a lot of friends with gut issues that have just cleared up and they just can't believe it. So that's all the things that just X39 and copper peptide do for you. So when you look at, like, there's this book, this is a whole book dedicated to reverse aging with copper peptide. And it talks about the immune system and the benefits of skin and the cardiovascular and role of exercise and making you stronger and performing. So again, all X39. So everyone starts with X39. But before I move on to the other patches, let me spend a quick moment to show you a patch. So here's the patch, right? You know, because you've seen it and you wear it and you put it anywhere on your body, 12 hours on, and then you take it off 12 hours. It's literally a little sticker. And it really actually can be on your clothing. It can be in your pocket. It doesn't even have to be on your skin. It can be attached to the inside, it face in the opposite direction. And what it does.
I did not know that you can wear it everywhere. Sorry for interrupting, but
Yeah.
I really literally thought you can only put it on those two spots. And this is so helpful because obviously where I am in summer, it gets so hot that it's really tricky to wear it. You know, you want to be in the pool, you want to be in the ocean, you don't want to tan and have these weird spots.
Right. No, yeah.
That's even more easy and doable as it is anyway already. So that's amazing. Yeah.
Yes, and here's why. There is a little pamphlet that comes with them and it says put it behind the back of your neck or below your belly button. The reason they do that is because for marketing purposes, they need to put out information showing where it was tested in our studies. That's all. There is tons of evidence, testimonial and otherwise, that supports the use of it. And any, you know, the inventor says you can put it on the top of your big toe. Now, there are a lot of people who suggest that along the acupuncture and acupressure meridians are really helpful. And we'll talk about that in a little bit more detail later. But so the way this works is, so let me just back up. If I were to look at you with night vision goggles, I would see light in you. And I love that I see light in you. I love that we are creatures of light. When we go out in the sun, we know that a specific frequency of light causes our body to make vitamin D or melanin, right? We know that our body there's 5,000 studies on light and the effects on the body. So photobiomodulation, which is really a fancy word of saying, you know, your body's chemistry changes with the light to, you know, beneficial biochemical results. That is not new and that is not controversial. it's pretty understood at this point in time. Although when you talk about energy healing or light healing, people get a little wonky and they think you're out, a Fruit Loop or something, but that's just not the case. We all understand that light makes a huge difference. So what this does, this little patch, is just reflecting your own light back at a very specific wavelength. It is actually non-transdermal, which means nothing is going into the skin. No medicine. It's not like a hormone patch. It's not like a lidocaine patch. There's nothing going in the skin. And to just prove the validity of that, there were over 300 Olympic athletes that wore these LifeWave patches in the 2008 Olympics. And people like Serena Williams and David Beckham and Michael Phelps and even now Tom Brady are wearing patches. So they would not risk their Olympic stature.
And I wouldn't wear it either if it had any harmful ingredients, or maybe not harmful, but any other ingredients. That's just not how I roll. So yeah, totally. Thank you for pointing that out.
Yeah, and the thing is, that means because there's nothing going in your skin, it's sort of like eating a salad or going out in the sun for vitamin D. There's no reason not to try it. And there's nothing it competes with in terms of any other modalities or prescription drugs or anything else someone's doing. A lot of people, well, I can't do this and I can't do that because of some medicine they're on or the side effects of something or whatever. But there's no competing modality for this. It doesn't matter. So when you look at the kinds of things we see from the X39 patch, most people report right away rapid pain relief or reduced. And when I say right away, let me just say cellular repair begins right away, but it takes 3 to 6 weeks to sometimes notice those things. Cellular regeneration, if someone told you it happened like right there, you probably should question that to begin with, because cellular regeneration and repair, that's mitochondria, that's all at the deep level and it takes some time. So rapid pain relief, reduced inflammation, supports the wound healing, energy and vitality we talked about, the mental clarity we talked about. I want to get into that brain study a little bit. Enhanced sports performance, so that's why our athletes are wearing that. Faster recovery from exercise. I love that because I've really had a hard time. Part of that's the fibromyalgia and the chronic fatigue that I've had, but I work out and I'm in so much pain afterwards. And I've always had to really limit my workouts because my recovery was just so poor. And I'm seeing a huge difference in my recovery. I'm stronger and I'm able to recover faster, which means I can actually lift different weights every day, just different ones. So the other thing is that we recommend, because that cellular repair takes a while, we recommend people wear it at least 1 month for every decade you are old to try it out and give it the chance it takes to just sort of reset all of those cells. So real quick on the brain, if I could, this brain study, because this if you could see a picture, there's an EEG of 2 brains. One is the first, before they start the X39, it's all red, and a little bit of other colors. And that red is a signal for inflammation. It's PTSD, it's anxiety, it's a non-communicating brain. We like to call it an LA traffic jam. And I don't know what your Australia equivalent of our LA traffic jam would be, but a significant like gridlock where the communication between the 2 hemispheres of the brain is just not happening. And on the second time they go to do the EEG, it's 3 weeks into wearing X39. And you already see the color map changing. You see the greens and the yellows and the blues coming in and mixing up and everything balancing already. And at the 6-week point, you have a totally different map of the brain. And people are reporting this. And what they are seeing is not only that cell and nerve regeneration, but a balanced brain, improved coherence, an improved nervous system, lowered anxiety, decreased brain inflammation, improved memory and focus and brain function. In fact, they found that the more complex the task and the process, the faster and better they did. So that's the brain study. There's a heart study. The heart study shows in 6 weeks, the cardiovascular system reversed age and was acting as though it were 8 weeks younger in 6 weeks. Remarkable, right? So the X39 is the patch to begin. From bulging discs to beautiful skin and collagen, it's where we begin. Now, what I would recommend is that people start with one other patch with the X39. Well, you can start with just X39. Let me put that out there. And this little tiny patch is like $99 for a 1-month supply. So beats $10,000 for an IV that may or may not work out of country by a long stretch, $99. What I really recommend though, one of the problems we have with our stem cells is they're eaten up by inflammation. Now, inflammation is just the root of all evil anyway, and I don't have to tell you that. You know that's why our skin, that's why our bodies, we can't get rid of all the toxins we're absorbing in our environment, in our foods. Just stress causes inflammation, injuries cause inflammation. So, and that's not to say that there's a reason for inflammation. It does the body good in certain instances. So I'm not saying it's all bad, but what I am saying is it eats those stem cells. So when inflammation is eating all the stem cells that you're increasing, you're not getting all the benefit of those stem cells. So what we like to do is lower that inflammation and increase our stem cell activity. And then we get the real bang for the buck. And that's particularly helpful for people who've had any kind of chronic illness of, joint pain, arthritis, any of those kinds of things. So I always like to start people off on what we call the dynamic duo, which is X39 and that Eon. And Eon used to be like the number one patch before X39 even came on the market. So that is where we begin. And if I were to have, so that's these two right here. If I were to have my way in the world, people would start on this and they would do this for a couple months. Now, if they've had COVID, if they've had the vaccine, if they have had, if they've been exposed to people with the vaccine, ultimately they have spike proteins. And those spike proteins cause respiratory illness and issues and heart, pericarditis and all sorts of bad things, right? So the other patch that I think everybody in the world ultimately needs to be on is glutathione. Glutathione, I was actually taking glutathione before I learned about the patches, orally and in IV. And the IV glutathione raised my glutathione levels 27% for a whopping 7 minutes. So didn't know that, paid a lot of money for that glutathione, but this patch raises our glutathione levels 300%, and it keeps up there for 24 hours. And what you can find is my friend actually did a red cell, the one that has the daughter and the cousin that had leukemia. She did a red blood live cell study, and on 6 slides, she had spike proteins, tons of them, all over the place. And they wanted to give her a prescription med and get rid of it. And she's like, no, let me just try these patches. So she added the glutathione, and she was doing then X39 Eon and glutathione, and went back at the 6-week point and got tested again. All of the spike proteins were gone, with the exception of one that was hiding behind the cell. So the people that live the longest in the world have the highest levels of glutathione. The people in the blue zones, that's because it's our body's master antioxidant. It's also our primary pathway for detoxification. Glutathione protects the DNA from damage. It increases stem cells and rejuvenates and protects them, reduces inflammation, increases collagen. We actually have had people that are using those 3 patches, the same 3 patches, X39 Eon and glutathione, and are rebuilding bone-on-bone knees that they thought were going to have surgery, but because they actually regenerate the cartilage. So those are the 3 that I think everybody needs to know about. And then I guess the only other one I would say for people, your audience that are in pain, there's just nothing in the world like IceWave. And IceWave is I don't go anywhere without IceWave. IceWave is perhaps the most demonstrative patch of all of them in the short term, because it works immediately. It works within 15 seconds and then gets better over the first hour or 2. And when I say it drops pain, it takes you from a 12 to a 0. And it's a matter of finding the right place. The rest of them you can put anywhere. It doesn't really matter. Other than it's nice to put them on acupressure points. It's good if you maybe have a hurt shoulder, to put the Eon, the anti-inflammation patch on there. If you're trying to rebuild a knee, the glutathione and the Eon on the knee are helpful to actually light that up first. But you really are going to get the benefits. The blood studies and everything show that you're going to get the benefits wherever you put it. Now, IceWave This is a precise placement. It has to be, it's a 2-patch system. There's a tan and a white patch. It needs to be in the exact right spot. But man, when you get that spot, bam, the pain is gone. And I just had people who were in, okay, what's your knee pain? Well, 1 to 10, it's a 12. And in seconds, it just disappears. And they are just crying with joy and so excited. And this is amazing because you can patch them over their clothing, wherever they are, and it can disappear. And they're like, oh my gosh. So it sort of proves a lot of people are very skeptical. I don't blame them. I was skeptical, like, how is this even possible that this little patch could do any of this? But when it takes away your pain, you believe, like, immediately you believe, like, okay, there is really something to this. So yeah, I've said a lot. I want to give you a chance to speak.
Absolutely amazing. Thank you so much for sharing your favorite patches. And I can't wait to try out these other 3, because clearly I've only tried the X39, which I absolutely love. And I am very skeptical from nature, even though I have to say that from the beginning, this made total sense to me. Like, I really loved, again, as I said before, how simple it is, but also the whole phototherapy. All of this really makes sense with how I studied, with the understanding that I have from all the modules, all my studies, all my learnings, and how the body then is able to reset. Yeah, but this brings everything to a total different level. I would love to ask a few questions around it. So let's say you're using 3 patches. Do we use them at the same time, or yeah?
Yes. And I'll actually share with you that, my husband and I actually don't start people off on glutathione, because X39 raises your glutathione levels by 30% already, which is starting to detoxify. So if you're not getting enough water, that can be hard on certain people if they're really toxic. I usually start people slowly, X39 and Eon, and then in a couple of weeks we add glutathione, and we started out with like maybe twice a week, and then we added 3 times a week, and we work our way up to daily. But my husband and I we didn't know anything. And I looked at all the patches, and I can go through some of the others and why we actually went on the others. There's X49, that's really good for brain and heart. There's carnosine, which is really good for brain and heart. There's Alavita, which is excellent for organs and the face. You would love that one. Energy enhancer, that's really good for the mitochondria. So we can talk about some others of those. But yes, there are some that are worn at night, particularly Alavita and Silent Night. So those 2 are just worn at night, and the others can be worn during the day or night. Most people wear X39 and X49 and energy enhancers during the day because they give you more energy, and then they promote your sleep. When I get up in the morning, I am putting on, Eon and actually Eon, glutathione, X39, X49, my SP6, which is my one for hunger and sugar cravings, energy enhancers, and glutathione. All of those go on me. Most of them, I actually put energy enhancers on the bottom of my feet. I put my X39 back here, unless I have like a hurt back or something, then I'll put it down behind my back. My Eon goes there. They all have a 12-hour clock. So let's just say I woke up and, at 7 a.m. I put all my patches on, but then at 10:30, I'm like, my back is just killing me. I'm gonna put some ice wave on. I put the ice wave on, and it's at 10:30 in the morning. And now it's nighttime, and 7 p.m. rolls around, and that's 12 hours since I put my patches on. All the day patches come off. But I can leave my ice wave on until 10:30. It's got its own 12-hour clock. Every patch has its own 12-hour clock. And then when I put my night patches off, I actually wear carnosine at night. I wear the Silent Night at night, and then the Alavita at night. So those 3 go on at night, and I wear those, and I actually wear them on my forehead. The Alavita in the middle of the forehead stimulates the pineal gland. And so carnosine actually improves vision. There have been people who've gotten rid of their glasses. I'm looking forward to that. I would love to get rid of my glasses. So carnosine over my eyes is really good for the eyes. And then the silent night, somewhere in the head, doesn't have to be, but it helps stimulate really very good dreams and deep sleep. So those three, but let's just say I put them on it. I get a late start. I go to bed at 10 p.m. Well, at 8 a.m. I've got a phone call. What I'll do is I'll just take them off my forehead and I'll just stick them on my arm. I'll stick them there until my 12 hours is up, and then I'll take those off. That doesn't mean I don't put my day patches on, even though I've still got my night patches on. So yeah, you can wear all of them at the same time. Some of the combos, we don't really, people don't have to start out with all of them. That I did, but that's because my husband has a very serious medical issue. And I was willing to throw everything in the kitchen sink, and I didn't have time to say what is going to work, how long, and then add this or that or whatever. I was just like, whatever, bring it on, let's try it. So, but there are people that just do X39 or just do X39 and Neon.
I love that. Absolutely. And a few more questions, just so I am sure I understand you correctly and my audience does so too. So I'm just thinking of a few clients that I have. Let's say someone is going through chemotherapy because of breast cancer or some other form of cancer. So did I understand this correctly, that during the treatment, you can still put on those patches to support the healing, and it won't interfere with any of the medication that they are getting?
Yes, what I have been told is that the patches will not interfere with their medication. The chemotherapy and radiation will kill everything. So what they say is the day that you're actually doing chemo and radiation,
Yeah.
don't wear the patches for like
Yeah.
72 hours, because you're just sort of wasting your money.
Yeah.
But as soon as that's done, they recommend the X39 Eon glutathione and Alavida, I'm sorry. Yeah, glutathione, X39 Eon glutathione, Alavida, and carnosine are what's recommended. And I can show you on my website, there's actually a picture of someone who had lung cancer and was just riddled with it. It was up through her throat. She could no longer swallow. They told her, you have 4 to 6 months to live. 5 months later, she was on those 5 patches. 5 months later, they show a scan. It's gone. Her PET scan is clear. She is feeling great. She is eating her. I mean, it is astonishing. I mean, again, we can't say we cure anything, but wow, right?
The body is doing its magic.
Our body is we are just helping the body do what the body knows how to do, right?
Exactly. Amazing. And let's talk a little bit about ADHD, or let me ask back. You already mentioned that it's very helpful for that. So this is a huge topic, and everyone around my daughters has been diagnosed with ADHD. At least it feels like this, to different levels. So also when they are on medication, again, I know it's a little bit of the same question. I just want to be really clear and sure here. And I think it's very assuring if you state all that you know. So again, here, they can use the patches with the medication as well.
Yes, they can. You'll find a lot of people at some point kind of go, I don't think I need my medicine anymore.
And that would be so wonderful.
Right. And that's not just with ADHD medicines. I will tell you that people need to check their blood pressure, because the blood pressure gets normalized. If it's low, it comes up. If it's high, it comes down. And if you're on a medication that's falsely lowering it, then you may need to come off of that medication. So you may need to pay attention to your blood pressure. Same with cholesterol, same with thyroid medicines. This pharmacist friend of mine who was taking augmenting with some natural thyroid medicine, she's no longer taking that, because this has just put her thyroid back into functioning properly. And she was taking a fair dose. Other people who have been taking cholesterol medicines, they come off over time. They, 4 to 6 to 8 to 12 weeks, they start looking and they're like, oh, wow, I don't need as much. And over time, that is the difference, right? When you're actually getting to the root, and I know you love that, right? You're holistic about, let's get to the root of the problem. Let's just not just mask it with some medicine. And as soon as you stop taking that blood pressure medicine, off goes your blood pressure, or stop taking that cholesterol.
You are creating more imbalances and have to then take medication because of the side effect of that medication. So like,
that's right. That's right. I mean, the side effects are scary on all the medicines. I mean, and those are the ones that they tell you or that they know.
yes.
Because when people are starting to add multiple medicines, now there's all sorts of other problems that really go with that.
Yes, I couldn't agree more. Okay, thank you so much for clarifying this. I just think this is absolutely brilliant and amazing. So are there any contraindications? So who cannot use these patches?
Oh, good question. The only people that we would say should not use the patches, or we can't recommend use the patches, are people that have an organ transplant and they have to keep their immune system down, or their body might fight that organ. And I tell you that however, I know of a handful of people who have organ transplants who are on the patches and experiencing great results, and they were just desperate, like they were gonna die, or that this organ was failing, right? There was just nothing else they could do, and they've got but the company cannot go on record saying anything about that. They've not had any in our studies. They would say we can't say pregnant women or children, but tons of pregnant women and children are on the patches because people are trying to. In fact, there's some evidence that suggests that pregnant women, that it's actually doing good to the baby, and that people that have high risk of other issues in utero, or even have identified issues in utero, could be corrected before birth. So there's just I mean, the company has done an enormous amount of research in stem cells.
Which I really appreciate, because it really helps to gain more trust. Sorry for interrupting again, but I really want to say, I think this is probably the most difficult thing about those patches, to trust in it, start with it, and apply it regularly. Because as you said, the body won't heal overnight. That's just not possible. Yeah, but we all want those quick fixes, and we are so used to work with quick fixes. So I think this is the biggest hurdle that we have to overcome, mainly in our minds. So if we can, like you said before, just trust, read through those amazing research papers, and wear it continuously for at least 30 days, because something will happen. It happened for you, it happened for me. And as I said, I only use this one patch, and I would say I'm in pretty good shape. And yet I still notice how much more energy I could feel, how my performance increased, how I could really focus better, my memory changed, my sleep was better. And yes, I love that I started to look younger, which is always appreciated when you are almost 50. So yeah, I can't wait to try the other patches. And sorry, that was a big interruption.
No, that was perfect. I love it. The company has a lot of credibility. We've been founded since 2004. There are over 90 clinical studies, as you referenced. The inventor has been on the leading edge of really reverse aging and regenerative science. He's been awarded the Advanced Technology Award from the International Hall of Fame twice. He's got over 150 patents. Most of them are on regenerative science. We have 15 global distribution centers, and we're distributing in over 67 countries. I will tell you this, in the last 4 years, since the X39 patch came out, our company has grown 20 times. And that's pandemic times. Like, that's not heard of. Like, in a time when our company was allowed to stay open, when hospitals and places, when anything that was not essential was shutting down, because our patches were helping, our manufacturing was able to stay open, because when we donated patches to doctors and nurses in hospitals, they were staying healthier and alive better, right? So it's a remarkable. I will also, I need to say this. I bet you have a worldwide audience, and some of that will include people in the United States. In the United States, the FDA has determined that stem cells, including your own stem cells in your own body, are a drug. And so in the United States, I cannot say that this X39 patch activates and elevates and regenerates and creates more stem cells. I can say it activates and elevates GHKCU, copper peptide. And oh, by the way, GHKCU happens to elevate stem cells. But I have to do this dance and this crosswalk. So our website's changing, the studies, everything, because we're getting so big now, and we're in a bit of a target now. So my current website, reverseaging.com, it has the studies really accessible, and it has all the stem cell language. It's going to change. I have to actually change it in the next 60 to 90 days to be compliant. So go look at it sooner rather than later, so that you can kind of easily access all of those studies and see all that marketing material about the stem cells before it has to get taken down or changed.
Thank you for that. And that would have been my next question, but I also wanted to ask back again. You've kind of browsed over this. So yes, also children can use those patches.
Yes.
And women, breastfeeding with women, obviously then also teenagers. And what about pets? So I actually know that you can use them for pets, but can you please go into this? How do we use them? Do we use the same dose for children, or do we have the patches, or do we put them on after we have? So what are your recommendations there?
Sure. No, you can use the whole patch. Don't ever cut it. Don't ever disrupt that lattice structure within. You don't have to reduce the amount of time on the child or the pet even. You can put a brand new patch on a pet. In fact, we have a whole line of IceWave for horses and veterinarians and dogs, and that's a lovely thing. But I'm not in the United States able to say this, but in Australia, I can say that we take our patches off of us at the end of the night, and we pop them on our pets, on the inside of their collar, on their bed, wrapped in a little vet tape, wherever they might be hurting or not. And we've seen glaucoma in dogs just disappear. We've seen the body heal, and the animals get out of pain and have more energy and act more like puppies again. So it is remarkable. There's a video on my website that shows horses that are patched with IceWave, which is actually called IQ Life for the animals. But you can just use IceWave. It's exactly the same patch. And it shows them patched for pain, and then they're like not responding to any kind of issues. But when you take the IceWave off, they're like, limping and injured and clearly in pain. So yes, and I've heard of people patching everything, including tortoise, fish, lizards. It's like any living creature, plants. People put them on their plants, any living thing, because it's helping the photo biomodulation, right? So yes, and you don't have to reduce. If there's somebody that's really sick, if a child is really sick, or anybody is really sick, you might think, I have only done this for a child, where we put him on Eon first for a few days, to just calm the nervous system down and just sort of calm everything down before putting the X39 on and having a detox effect. And in the very first day of wearing Eon, this non-verbal autistic child, when the mother tucked him into bed and said, I love you, son, this non-verbal child said, I love you, Mom, back. And she just texted me bawling, like, oh my gosh. So huge. In one day, one patch. There are a lot of one patch miracles with X39. I haven't heard of a one patch miracle for Eon, but there you are. I do see people experience pain relief with X39 and Eon within, hours, but I haven't heard of that. So that was pretty cool.
Absolutely amazing. So
babies are patched, babies, even little babies.
So I didn't know that. So thank you so much for sharing this. So where can my audience access those amazing patches? Where can we find you?
Yeah, I am reverseaging.com is my website, and you can dive into the science. You can see a video on how it works. You can click a link to GHKCU and learn more about GHKCU. You can see testimonials from doctors, testimonials from people who are not doctors, the NFL football players and others. It talks about how to wear the patches. There's a deep dive where David, the inventor, is actually talking to practitioners, and he gets very medical jargon and scientific for the people that want to get really deep. And then there's another kind of higher level, video that he's just sort of talking about how it all works. So more than it took me weeks to actually look at all of the things on that site. And I've now gone through every one of the 90 clinical studies. I've read them, I've summarized them, I've got links to them. I've not, just know that I didn't start by talking. This was not something I was ever planning on talking about. It was something for my family and my friends. And now I just feel it would be doing a disservice to everyone for not sharing it. So I again, $99 for the X39 and $49 for Eon and all the other supported patches. There is a patch for those, elite athletes called X49, but I also like it for the elderly population, for people, older women who need increased bone density. And I love that it's the X39 is the bleeding patch, but X49 is elevating a daughter peptide, and that improves the performance and energy and strength and stamina, and it supports the cardiovascular system and cognitive function, because AHKCU is found in the heart and in the muscles and in those areas. So you can't tell your stem cells where to go. Like, you may have a hurt knee, or I want all these X39 stem cell activated in Jim's brain, my husband's brain, right? But it doesn't necessarily go there. It may be his lower back. He did 1,200 carrier air wing landings, traps on an aircraft carrier. So it could be that the stem cells say, yeah, it's actually your back. Probably not, but it could, right? So we can't say where they go. But X49, we know the AHKCU peptide hangs out in the heart and the brain. And so this patch, especially when combined with X39, it improves lean muscle mass, it improves fat loss, it increases bone density, something I really wanted for my elderly parents, for myself. They're sturdier. They were at risk for falling. My mom fell and broke a fibula, and then this was the beginning of a downturn for her, with a stay in the hospital, a stay in a supporting facility where she got COVID, where she then lost her sense of smell and taste, and all of the things, like her brain fog started, and we're just getting her back to where she's starting to taste again. And I kind of credit the patches to helping with that, and not to mention that they're sturdier and stronger. She used to hold on for dear life every place we used to go, and now neither of them. They're just like charging away. So it's wonderful when you can see the difference in elderly. But that X49 patch is something that a lot of elite athletes like for that quick recovery, and I think is great for the older people as well. So lots of patches to look in. There's a video on each of the patches. If you hit, you can dive in and see the descriptions of each of them and what they do, and why, and I'm happy to talk with people. I'm happy to do a free consultation, and that you can say, well, I have, whatever the issue is, maybe it's diabetes, or, I have a child that's autistic, or, someone that's got pneumonia. What do I do? And then I can, I'm not saying that we're going to cure or prevent or just treat this, but I'm saying this is what I would recommend to help support your body in healing itself in these areas.
I love it. And I can't thank you enough for really doing this service to our world, really, and to help to reset the ability of so many bodies to heal, rebalance, and regenerate, because it is truly important and life-changing. So I want to thank you from the bottom of my heart for being here today and for sharing all your amazing knowledge and your wisdom. I am a huge fan of these patches, and I'm so much more excited now that I understand even more about them and how to use them, and that I know the big variety that there is. I can't wait to do more work with you together, to learn more from you, and to help my clients even more through those patches. So honestly, thank you from the bottom of my heart. I think this is absolutely life-changing and amazing, because it is non-invasive, it is fairly affordable, it is so easy to do. The hardest bit about it truly is trusting and being a little bit patient. I think if we tell ourselves this, we can do this. So thank you. You're amazing.
Thank you, Ruth. You're amazing. I appreciate all that you do for the good in the world, for people, for inspiring people, for helping people think in a holistic and natural way about the alternatives, and helping people to take charge of their own health and not just get boxed into a prescription medicine and surgery approach. There's just no one like you in the world. And I really, I'm honored to be on your podcast and to be with you tonight, and today, this morning for you, but tonight for me. And thank you for the time. Thank you for sharing all that you share all the time. I appreciate you.
Thank you so much. It's been such a pleasure. Take care, beautiful.
Thank you, Ruth.
I hope you loved and enjoyed this episode as much as I did. If you did, could you please do me a favor? I can't do it without you. Can you please help me to make our world a healthier, happier place? And you can do so by liking, subscribing to, sharing, or reviewing my podcast, because this will help that others can find the content in this podcast too. I know that you were born to glow, to feel absolutely amazing in your precious body, your brilliant mind, and your boundless soul. So what are you still waiting for? Please make sure you do. I'm your biggest cheerleader. Keep glowing.